Well, aside from the days getting longer, it's real tough to see or even feel any signs that winter is beginning to ease its grip across America. People having to brave the cold with a shovel in their hand and clean their sidewalks, their driveways. But in the bitter cold, frostbite, even hypothermia can become a real concern.
Yeah, Stephen, in a situation like that, every second matters. So it's important to know how to stay safe in the bitter cold.
And we continue the conversation this morning on Weather Command. Dr. Taryn Travis joins us again. Dr. Travis is a burn surgeon. It's great to see you again. Thanks for joining us here on Weather Command. Some people might know this already, but burn surgeons are the doctors that specialize in tissue damage and treat severe frostbite. So you're great to talk to about this topic. Kind of a nuanced question, but with your experience in your practice, is there a temperature threshold or maybe a wind chill threshold where you start to see more patients coming in with frostbite? Because we have felt it all, Dr. Travis, from 0 to -50 wind chills this week.
Right. Now is that time, to be honest with you. We've been getting a lot. I was on call last night and got 2 new frostbite patients. So the challenge with frostbite is that a lot of the treatment seeking from patients is delayed. And so I, for instance, got a patient who had her exposure to the snow and the cold on Sunday and came in last night realizing, oh gosh, things don't look right. And as we've talked about before, that time element is so important. But to your original question, the temperature and the timing in where we need to be worried, you guys often show that wind chill chart from the National Atmospheric Organization. And basically you can track the temperature outside and the wind chill and see how long it'll take you. And with the temperatures we're seeing in this country right now, 30 minutes is maybe all that's safe for people. And so since everyone who's watching this program is located in different areas, what I like to tell people is when you start feeling numbness and tingling, that's really your warning. And so in some places that might happen in 30 minutes. And in some other places, exactly that chart, in some other places, that's going to happen in 5 or 10 minutes. And so more than asking someone to memorize this time, it's about paying attention to what you're feeling and knowing that when you start feeling those changes, it's time to get warm.
Yeah, and Dr. Travis, you said it there. I mean, what some of the earliest signs is the numbness. You kind of start to feel that maybe in your fingers and your toes. But what are some other signs or first signs that maybe you're starting to feel the beginnings of frostbite? Or also on top of this, to tell if frostbite is progressing from a surface injury to a serious tissue damage, what are the signs of that happening too?
So the things that we want people to be really aware of and alarmed by if they see it is color change. So once you get back into warmth, which hopefully can happen as soon as possible, if that numbness and tingling doesn't resolve, or you're seeing redness, purpleness, blue, gray, or even sort of white, waxy skin, that is all stuff that indicates an emergency. Blistering, while a lot of times, for instance, a blister with a burn isn't necessarily going to be serious, in frostbite it very well can be, because that's sort of what bubbles up to the surface when the injury itself is deep down. The injury itself is happening where those ice crystals form in the tissue, where those teeny tiny blood vessels get clotted off. And so if you get to the point where you've got color change and blisters at the surface, that means what's going on inside is potentially even worse. So those are the things we really want people to pay attention to and get themselves to medical care if they see those, because we have a very limited window in which we can intervene. And once we pass that window, it's really kind of a watch and wait wound care situation. And this is how we end up with folks with amputations and those sorts of complications.
My social media feeds, Dr. Travis, have lately been filled with people who have to endure these cold temperatures. Fairbanks, Greenland, even in Asia, up in Siberia, where the air is just brutally cold. And I am wondering from a medical perspective, you did kind of mention this already, but I find it so fascinating. Why is a -60-degree wind chill worse for the skin, or why does the frostbite set in quicker than, say, -20? I guess it kind of just makes common sense, but what's your skin doing? Why can't you have it exposed in -60 for as long as -20?
Right. So this is all really about how our bodies evolved for survival, right? So if you as a human are going to survive in cold temperatures, your body is going to divert all of that blood and warmth to your core, keep your brain perfused, keep your lungs perfused, your kidneys, etc. So basically, and this is something that's involuntary, we're going to clamp down those blood vessels out in the periphery, which is why we see frostbite most commonly at the tips of things. Distal is the word for it in medical speak. So at the tips of things, tips of the nose, fingers, toes, etc., those are going to clamp down and not really be perfused when your body is fighting to stay warm altogether. So this is why, even though, your chest is less likely to get frostbite than your fingertips, it's important to be covered up all over, because it helps keep that blood flow and that perfusion and what keeps you warm out to the periphery so that you can protect your fingers. And something we've mentioned on this show before that I think is worth reiterating, because people don't always know this. The instinct is to do this, right, when your hands are cold. And if you're actually suffering some frostbite, part of that problem is little ice crystals that form in your tissue and damage your cells. So if you do this, if you can imagine sandpaper, you're actually worsening that traction and that injury and that tension on that tissue. And so people need to get inside, warm themselves up in warm air, lukewarm water. We don't want people burning themselves on top of having frostbite. But any sort of friction can be a problem on these already damaged tissues with ice crystals and blood vessels that have clamped down. So all of it sort of works together.
I had no idea. Good to know. I've been going like this all the time.
I know. We find it so educational when we get to talk to you, Dr. Travis. I mean, we're going to have you on as often as we can. There was one question, and Marissa Torres, she's normally here on Weather Command during the week. She's bummed that she's missing you, but we've been talking about the cold here, and there was a little discussion we had yesterday. I want to play that, and then we'll talk on the backside. Take a listen.
Okay.
I was talking yesterday about how it stings. You take a breath of air and it just stings your nasal cavity all the way down.
Yeah, it's tough. And the reason for it, medically speaking, I mean, it reminds me of when you eat mints and then you breathe in that air and it just burns just a little bit. Now, I know I sounded more foolish, but that's beside the point. We have a separate conversation. The burning sensation, why is that?
I can't tell you scientifically why that happens. What I will say is that generally speaking, and we're not even necessarily talking about burns in particular, but that's how my brain works. Human bodies don't like to be cold. They just don't. And so we lose so much heat through our skin, which we've talked about before also, but any sort of exposed mucous membranes, when we have people in surgery and have cavities open, they lose heat through those cavities. And so really the way that our bodies are designed are to keep as much of that heat in as possible. So if you take a big deep breath of cold air, that's sort of a warning sign. And we're sort of designed to have those sensations as a warning sign to our brains that you need to get out of this and you need to get warm. And it's interesting because if you think about it, sort of in my other part of my job in the operating room, which will be in a couple minutes, we cover patients up as much as we possibly can, because you can just lose heat through radiation. And so same thing through your mucous membranes in your nose, in your mouth, et cetera, you can lose heat through all those things. And that's what you're feeling when you have that stinging sensation.
That answers it.
Wow.
No, that answers it totally.
Oh my gosh.
Pass it along to Marissa.
This was such a good information. I learned a lot, actually, seriously, and I was just out in the cold, and now I can use these tips to make sure I'm staying safe. So thank you again, Dr. Taryn Travis, for joining us this morning. This is a burn surgeon with MedStar Washington Hospital Center, Dr. Taryn Travis. Thank you again.
See you guys again soon.
All right. Appreciate your time this morning.